Okay, so have you ever seen those like amazing before and after photos of teeth cutting online?
Oh, yeah.
Like, honestly, who would want to upgrade their smile?
Right.
It just seems like the perfect quick fix, right?
Yeah.
Well, before you like book that appointment, um, we're going to do a deep dive into what you really need to know about teeth contouring, and
Yeah.
most importantly, if it's the right choice for you.
A lot of people think it's just about like filing down a pointy tooth or something, you know?
Right.
But contouring can actually involve like reshaping the enamel. That's that hard outer layer of your tooth. It's more like this subtle sculpting to adjust your smile.
Okay, so I'm kind of intrigued, but before we get to the sculpting part, I'm guessing there's some prep work involved, right?
Absolutely. Your dentist will first check the health of your enamel and your gums. Healthy enamel is like essential because it protects your teeth from damage and decay. It's like the armor for your teeth.
Yeah, that makes sense. So what happens if your enamel isn't in like tip-top shape? Is contouring like off the table?
It might be. If your enamel is weak or thin, contouring could actually like weaken it further, and that's like the opposite of what we want. So in those cases, your dentist might suggest veneers instead.
Deniers. Now those sound familiar, like something I've heard celebrities talk about.
You've probably heard of them. Think of veneers as like custom-made covers for the front of your teeth. They're thin shells, usually made of porcelain, and they can instantly fix things like discoloration chips or even slightly crooked teeth. It's like giving your smile like a total makeover, but it's a more involved procedure than contouring.
Okay, got it. So back to contouring. Let's say my enamel like checks out. What happens next? Do I just plop down in the chair and say like make me look like a movie star?
Not quite. Your dentist will actually start by marking your teeth. It's like creating a roadmap for the reshaping process. This helps them visualize the final result and make sure you're both on the same page.
I like that. No surprises. So then what kind of tools are we talking about here? Is it like a tiny jackhammer?
Haha, nothing so dramatic. It's more like sculpting with tiny, precise instruments. Dentists use things like sanding discs or fine diamond burrs to gently remove small amounts of enamel. I once had a patient describe it as a gentle polishing rather than drilling.
Okay, that puts my mind at ease a little. Polishing sounds much more manageable. So walk me through the actual reshaping. Like what's happening to my teeth?
So the dentist will use those tools to smooth out any like rough edges, maybe shorten a tooth that's a bit longer than the others, or even close small gaps. It's all about creating a more balanced and symmetrical look.
And is this where bonding comes in? I've heard that term like thrown around in relation to contouring.
Yeah, you're right. Bonding is often used as an add-on, especially for more extensive reshaping. It involves applying a tooth-colored resin to the tooth, and this resin hardens and then becomes part of the tooth structure, almost like building it up.
So if I have like a chipped tooth, could bonding help with that?
Absolutely. Bonding's a great way to repair chips or fill in larger gaps. It basically creates a more uniform surface.
Interesting. Now, one thing I'm always curious about with any dental procedure is the time commitment. Am I looking at like hours in the chair?
That's one of the biggest appeals of contouring. The procedure itself can often be completed in just 10 minutes, depending on like what's being done. Imagine skipping like months of braces and achieving a similar result in just one 10-minute session.
Wow, 10 minutes. That really is quick. I spend longer than that just deciding what to eat for breakfast. So it's fast. But what about the pain? Is it one of those like beauty is pain situations?
Not at all. Remember, we're mainly working on the enamel, and that doesn't have nerves, so it's usually painless. Anesthesia is like rarely needed for basic contouring.
That's music to my ears. So no pain, quick procedure. Sounded pretty good so far. What about the recovery? Can I go about my day like as usual right afterward?
For simple reshaping, the recovery is minimal. You might have some slight sensitivity for a day or two, but it usually goes away pretty quickly.
Okay, good to know. So assuming I'm not getting any bonding done, I can basically head straight back to my routine.
Pretty much. However, if you do have bonding, you'll need to be a bit more careful.
Oh, how so?
The bonding material, while strong, isn't quite as tough as your natural enamel. So for a while, you'll want to avoid biting down on hard foods, chewing ice, or even things like biting your nails. Those habits could chip or crack the bonding. You'll also want to watch out for things that could stain, like coffee tea and red wine.
Ah, so I might have to lay off my morning coffee for a bit. Duly noted. Now let's talk about everyone's favorite topic, money. How much does this smile transformation typically cost?
On average, you're looking at somewhere between $50 and $300 per tooth for contouring.
Okay, that's a pretty decent range. What about insurance? Will they cover this or am I on my own?
Unfortunately, most insurance plans consider contouring a cosmetic procedure, so they don't usually cover it. But there's an exception. If you chipped a tooth due to, like, an accident, your insurance might cover some or all of the cost.
That's good to know. And compared to other options like braces or Invisalign, contouring seems much more affordable.
Absolutely, especially when you consider that braces can cost thousands of dollars. So yes, contouring can be a much more budget-friendly option.
All right, so we've covered the basics, what it is, what happens during the procedure, recovery, and even the cost. But now I want to get to the heart of the matter. Is teeth contouring the right choice for everyone? Or are there certain people who should maybe consider other options?
That's a great question. It's important to understand that contouring isn't a magic wand that can fix every dental issue. It's more like a fine-tuning tool for minor imperfections on otherwise healthy teeth.
Okay, so it's not a miracle cure-all. I appreciate the honesty. What would you say are some of the most appealing benefits of contouring?
Well, as we've already touched upon, the speed and ease of the procedure are major pluses. It's quick, relatively painless, and doesn't require much downtime. And let's not forget about the cost. It's significantly cheaper than many other cosmetic dentistry options, which is a big draw for a lot of people.
That cost difference is definitely something to consider. I'm curious from your experience, is that a major factor for many patients choosing contouring?
Absolutely. It's often a deciding factor for people who want to improve their smile without breaking the bank. But beyond the cost and convenience, there's also a potential hygiene benefit to contouring.
I'm all ears. Tell me more.
When your teeth are smoother and more evenly shaped, it can actually be easier to clean them effectively. This can lead to better plaque control, which in turn reduces the risk of cavities and gum disease.
So it's not just about aesthetics. It's about boosting your overall oral health. I love that. But let's flip the coin for a moment. What are some potential drawbacks or risks that someone considering contouring should be aware of?
One thing to keep in mind is that if too much enamel is removed during the procedure, it can lead to tooth sensitivity. Enamel protects the sensitive inner layers of your teeth, so removing too much can expose those layers, causing discomfort.
That makes sense. So it's like a delicate balance between achieving the desired shape and preserving enough enamel for protection.
Exactly, and along those lines, there's also a small risk of tooth fracture. If the enamel is thinned out too much, it can weaken the tooth
Mm-hmm.
and make it more susceptible to chipping or breaking.
Okay, that's definitely something to consider. What about other limitations? Are there any dental issues that contouring simply can't address?
Definitely. Contouring is not a solution for major dental problems like severe crowding bite issues or significant decay. It's really best suited for minor cosmetic imperfections on otherwise healthy teeth.
Got it. So while it's a fantastic option for some, it's not a magic bullet for every dental concern. And with that in mind, I think it's time to explore some alternatives. If contouring isn't the right fit, what other options might someone consider?
Well, for serious alignment issues like crowding or bite problems, braces are often like the gold standard. They've come a long way from the clunky metal braces of the past.
I was just thinking about those metal train tracks. So what's different now?
There are so many more options these days. You've got ceramic braces, which are much less noticeable because they blend in with your teeth. And then there are lingual braces, which are actually attached to the back of your teeth, so they're practically invisible from the front.
Wow, so discreet. It seems like there's a solution for almost everyone now. And speaking of discreet options, what about Invisalign? I feel like I'm seeing their ads everywhere.
Invisalign is a fantastic alternative to braces, especially for mild to moderate crowding or spacing issues. Instead of brackets and wires, they use a series of clear removable aligners that gradually shift your teeth into place.
So you can straighten your teeth without anyone even realizing you're wearing braces? That's pretty amazing. But how does Invisalign compare to traditional braces in terms of cost and treatment time?
Invisalign can be a bit more expensive than traditional braces, but for many people, the convenience and aesthetics are worth the extra cost. And the treatment time can vary depending on the complexity of the case, but it's often comparable to braces.
Got it. So it's really about weighing your priorities and discussing the pros and cons of each option with your dentist or orthodontist.
Exactly. There's no one-size-fits-all answer. It's about finding the best solution for your individual needs and lifestyle.
Now let's circle back to veneers for a moment. We talked about them briefly earlier, but I'd love to delve a little deeper. They seem like a more dramatic solution than contouring, right?
Yes, veneers are definitely a more involved procedure. Remember those custom-made covers we talked about? Well, that's exactly what veneers are. They're thin shells, usually made of porcelain, that are permanently bonded to the front of your teeth.
So it's like giving your teeth a whole new facade. What kind of issues can veneers address?
Veneers are a fantastic option for covering up imperfections, like severe discoloration chips, cracks, gaps, or even misshapen teeth. They're like the ultimate smile makeover.
So if you're looking for a Hollywood-worthy transformation, veneers might be the way to go. But are there any drawbacks to veneers?
One thing to consider is that veneers are more permanent than contouring. The process involves removing a small amount of enamel to make room for the veneers, so it's not something you can easily reverse.
That makes sense. So it's a commitment. Anything else to keep in mind?
Veneers are also more expensive than contouring, but they can last for many years with proper care.
All right, so we've explored a range of alternatives to teeth contouring, braces, Invisalign, and veneers. Each option has its own set of pros and cons, and it's important to talk to your dentist or orthodontist to figure out the best approach for you. But before we move on, I want to shift gears for a moment and address something really important, the emotional side of things.
I'm interested. What do you mean by the emotional side of things?
Well, we've talked a lot about the technical aspects of these procedures, but what about the mental and emotional preparation? How can someone prepare themselves for a dental transformation? Whether it's contouring or a more involved procedure, it's a big change. It can be nerve-wracking.
You're absolutely right. It's easy to get caught up in the details of the procedure itself, but the emotional aspect is just as important. After all, we're talking about your smile, which is a huge part of your identity and how you present yourself to the world.
Exactly. So what advice would you give to someone who's feeling anxious or apprehensive about undergoing a dental procedure? I know I'd be a little nervous.
The first thing I'd say is don't bottle up those feelings. It's perfectly normal to feel nervous or uncertain about any medical or dental procedure. Acknowledging those feelings is the first step to coping with them.
That's such an important point. It's not about pretending you're not nervous. It's about finding healthy ways to manage those feelings.
Absolutely. And one of the best ways to do that is through open communication. With your dentist or orthodontist, don't be afraid to express your concerns, ask questions, and seek reassurance. A good dental professional will understand your anxieties and work with you to create a comfortable and supportive experience.
I think that makes a world of difference. Knowing that you're in good hands and that your feelings are being heard can really ease those pre-procedure jitters.
Definitely. And beyond talking to your dentist, there are other things you can do to prepare yourself mentally. For example, you might find it helpful to practice relaxation techniques like deep breathing or meditation.
Those are great suggestions. Anything else that comes to mind?
Visualizing a positive outcome can also be powerful. Imagine yourself smiling confidently after the procedure. Picture yourself enjoying the benefits of your newly transformed smile.
That's a good tip. Focusing on the positive can really shift your mindset and reduce anxiety.
And lastly, remember that you're not alone in this journey. Connect with others who have undergone similar procedures, share your experiences, seek support, and celebrate each other's successes.
That's such a valuable reminder. There's strength in shared experiences. And knowing that others have walked this path before you can be incredibly empowering.
Exactly. And at the end of the day, remember that it's your smile, your journey. Embrace it, own it, and don't be afraid to seek the support and guidance you need along the way.
Well said. We've covered so much ground in this deep dive, from the ins and outs of teeth contouring to the emotional aspects of dental transformations. But before we wrap up, I have one final thought-provoking question for you and for our listeners.
I'm all ears. What's on your mind?
We've talked about the importance of choosing a qualified and experienced dentist, but what specific questions should you ask to make sure they're the right fit for you? And what red flags should you be aware of? We'll dive into those questions and more when we return for part 2 of our deep dive into teeth contouring. So, when we were talking before about those tools, like the sanding discs and diamond burrs, I have to admit it sounds a little intimidating.
Yeah.
Is it really like having a mini construction zone in your mouth?
I get why you would think that, but it's really not that intense. Like, the names might sound a little scary, but the actual process is pretty gentle. The dentist uses those instruments with incredible precision to remove tiny amounts of enamel. It's more like delicate sculpting than heavy-duty construction.
Okay, sculpting sounds much more appealing. Are there any situations where contouring might actually be painful?
In most cases, no. Remember, we're working on the enamel, and that doesn't have nerves. But there are a few exceptions, like if a significant amount of enamel needs to be removed, or if the tooth is already sensitive, you might feel some discomfort.
So it's always a good idea to talk to your dentist about any sensitivity issues before the procedure.
Absolutely. Open communication is key. They can assess your individual situation and determine if any pain management techniques might be helpful.
Now, another question I have is about the longevity of contouring. Is this a one-and-done deal, or will I need touch-ups down the line?
That's a great question. The results of teeth contouring are considered permanent, meaning like the reshaping itself won't revert. However, your teeth are still subject to like wear and tear over time.
That makes sense. I mean, we use our teeth every day, multiple times a day, so it's bound to have some impact.
Right. Factors like natural aging, grinding your teeth, or even the types of foods you eat can cause like minor changes over the years.
So it's kind of like getting a haircut. It looks amazing at first, but eventually you need a trim to keep things looking sharp.
That's a perfect analogy. Regular dental checkups are crucial to monitor any changes and address them early on.
Got it. Okay, so we've covered the procedure itself, the costs, the aftercare. Now I want to circle back to something we mentioned earlier, the alternatives to contouring. So let's say someone's decided that contouring isn't the right fit for them. What other options do they have? And how do those compare?
Well, as we discussed for significant alignment issues, like crooked teeth or bite problems, braces are often the go-to solution. They involve attaching brackets to your teeth and using wires to gradually move them into the desired position.
I know braces have come a long way since we were kids, but I still have this image of those clunky metal braces.
Oh, they've definitely evolved. Nowadays, you have options like ceramic braces, which are much less noticeable because they blend in with your teeth. And then there are lingual braces, which are attached to the back of your teeth, so they're practically invisible from the front.
It's amazing how much more discreet orthodontic treatment has become. And speaking of discreet, what about Invisalign? Those seem to be incredibly popular.
Invisalign is a fantastic option for those with mild to moderate crowding or spacing issues. They use a series of clear, removable aligners that are custom made to fit your teeth.
So you can straighten your teeth without anyone even knowing you're wearing braces. That's pretty amazing. But how does Invisalign compare to traditional braces in terms of cost and treatment time?
Invisalign is often a bit more expensive than traditional braces, but many people find the convenience and aesthetics worth the extra cost and the treatment time. While it varies depending on the complexity of the case, is often similar to braces.
Interesting. So it really comes down to personal preference and what's most important to you, discretion cost, or maybe a combination of factors.
Exactly. It's a personal decision, and it's important to weigh the pros and cons of each option with your orthodontist to determine the best fit for your individual needs.
Now let's talk about veneers. Those seem like a more dramatic solution, right?
Veneers are definitely a more involved procedure than contouring. Remember those custom-made covers we talked about earlier? Those are veneers. They're thin shells, usually made of porcelain, that are bonded to the front of your teeth to create a whole new surface.
So it's like giving your teeth a brand new facade. What kind of issues can veneers address?
Veneers are great for masking imperfections, like severe discoloration, chips, cracks, gaps, or even misshapen teeth. If you're looking for a significant smile transformation, veneers can be a great option.
So if you're going for that Hollywood-worthy smile makeover, veneers might be the way to go. But what about the downside? Are there any drawbacks to veneers?
One thing to consider is that veneers are more permanent than contouring. The process involves removing a small amount of enamel to make room for the veneers, so it's not something you can easily reverse.
So it's a commitment. Anything else to keep in mind?
Veneers are also more expensive than contouring, but the good news is that they can last for many years with proper care.
All right, so we've covered the procedure itself, we've talked about costs and aftercare, and we've explored some alternatives, like braces, Invisalign, veneers. Each option has its own pros and cons, and it's crucial to consult with your dentist or orthodontist to figure out the best approach for you. But before we move on to choosing the right dentist, I think it's important to address the emotional side of things.
I agree. What are your thoughts on that?
Well, we've talked a lot about like the technical aspects of these procedures, but what about the mental and emotional preparation? Like how can someone prepare themselves for a dental transformation, whether it's contouring or a more involved procedure where it's a big change? And it can be nerve-wracking.
You're absolutely right. It's easy to get caught up in the details of the procedure itself, but the emotional aspect is just as important. After all, we're talking about your smile, which is a huge part of your identity and how you present yourself to the world.
Exactly. So what advice would you give to someone who might be feeling anxious or apprehensive about undergoing a dental procedure?
First and foremost, I would encourage them to acknowledge and validate those feelings. It's perfectly normal to feel nervous or uncertain about any medical or dental procedure.
That's so important. It's not about pretending you're not nervous. It's about acknowledging those feelings and finding healthy ways to cope with them.
Exactly. And one of the best ways to do that is through open communication with your dentist or orthodontist. Don't be afraid to express your concerns, ask questions, and seek reassurance. A good dental professional will understand your anxieties and work with you to create a comfortable and supportive experience.
I think that makes a world of difference, knowing that you're in good hands. and that your feelings are being heard can really ease those pre-procedure jitters.
Definitely. And beyond talking to your dentist, there are other things you can do to prepare yourself mentally. For example, practicing relaxation techniques like deep breathing or meditation can be incredibly helpful.
Those are great suggestions. Anything else?
Visualizing a positive outcome can also be powerful. Imagine yourself smiling confidently after the procedure. Picture yourself enjoying the benefits of your newly transformed smile.
That's such a great tip. Focusing on the positive can really shift your mindset and reduce anxiety.
And lastly, remember that you're not alone in this journey. Connect with others who have undergone similar procedures. Share your experiences, seek support, and celebrate each other's successes.
It's a valuable reminder there's strength in shared experiences. And knowing that others have walked this path before you can be incredibly empowering.
Exactly. And at the end of the day, remember that it's your smile, your journey. Embrace it, own it, and don't be afraid to seek the support and guidance you need along the way.
Well said. I think we've covered a lot of ground today, from the nitty-gritty details of teeth contouring to the emotional aspects of dental transformations. But before we wrap things up, I have one final crucial question for you and for our listeners.
I'm intrigued. What is it?
We've talked about the importance of choosing a qualified and experienced dentist, but what are some specific questions you should ask a potential dentist to make sure they're the right fit for you? What red flags should you be aware of? We'll tackle those questions and more. In the final part of our deep dive, stay tuned. So as we were saying before, finding the right dentist can be kind of tricky.
Yeah, it really can be.
I mean, there's just so much information out there, like before and after, photos, online, reviews, fancy websites.
Right.
But how do you cut through all the noise and find a dentist who's not just skilled, but also a good fit for your personality and needs?
You've hit on a really crucial point. Technical skills are definitely essential, but feeling comfortable and confident with your dentist can truly make or break your experience.
Absolutely. So let's say I'm on the hunt for a dentist who specializes in teeth contouring. What are some key questions I should be asking during that initial consultation?
I'm glad you asked. First and foremost, you want to inquire about their experience, specifically with teeth contouring. You know how many procedures have they performed? What kind of results have they achieved? Don't hesitate to ask for before and after photos of their work, especially cases that are similar to yours.
That makes sense. Seeing is believing, right? I definitely want to see evidence of their expertise before entrusting them with my smile.
Exactly. It's your right as a patient to be informed and to feel confident in the dentist's abilities. You should also ask about their approach to contouring. Do they use the latest techniques and technologies? Are they conservative in their approach? Prioritizing the health and integrity of your teeth? Over-aggressive reshaping?
Okay, so it's not just about achieving a certain shape. It's about making sure it's done in a way that preserves the long-term health of my teeth. I like that holistic perspective.
Absolutely. It's about finding a dentist who sees the big picture and prioritizes your overall oral health. Beyond technical expertise, pay attention to how they communicate. Do they listen attentively to your concerns and answer your questions patiently and clearly? Do they make you feel comfortable asking questions and expressing any anxieties you might have?
Those are such important points. I've definitely had experiences where I felt rushed or dismissed by healthcare providers. And it makes a huge difference when you feel heard and understood.
I couldn't agree more. Feeling comfortable and respected is essential to a positive experience. And speaking of the experience itself, don't be shy about asking about the specifics of the procedure. What kind of tools will they be using? Will they be taking any special precautions to minimize discomfort? What can you expect during and after the procedure?
Okay, so it's about being proactive, asking questions, and really digging into the details to make sure you're fully informed. I like that. Now let's talk about red flags. Are there any warning signs that should make me think twice about choosing a particular dentist?
Absolutely. One major red flag is a dentist who seems overly eager to contour your teeth without a thorough examination or discussion of your goals and expectations.
So someone who's more focused on the quick fix than the long-term health and aesthetics of my smile.
Exactly. They might be rushing into the procedure without fully understanding your needs or considering potential risks. Another red flag is a dentist who is dismissive of your concerns or unwilling to answer your questions thoroughly.
That's a big one for me. I want to feel like my concerns are being taken seriously, not brushed aside.
Absolutely. You deserve to feel confident and comfortable with the dentist you choose. And remember, you're not obligated to go with the first dentist you consult with. It's perfectly okay to shop around and get multiple opinions until you find someone you truly trust and feel good about.
That's such an important reminder. It's your smile, your health, your investment. You deserve to feel empowered. in your decision-making process. So as we wrap up our deep dive into teeth contouring, what are some key takeaways you'd like our listeners to remember?
Great question. First, remember that while teeth contouring can be a fantastic way to enhance your smile, it's not a one-size-fits-all solution. It's crucial to have realistic expectations and understand the limitations of the procedure.
Right, it's not a magic wand that can fix every dental issue.
Exactly. And secondly, thorough research and careful selection of a qualified and experienced dentist are absolutely paramount to achieving optimal results and minimizing any potential risks. Don't cut corners when it comes to your oral health.
We can't stress that enough. Finding the right dentist is crucial.
And lastly, open communication with your dentist is key. Throughout the entire process, don't be afraid to ask questions, express your concerns, and advocate for your needs.
Well said. I think we've covered a lot of ground today. From the technical aspects of the procedure itself to the importance of finding the right dentist and feeling empowered in your choices, we've really explored it all. So as we sign off, we want to leave you with one final thought to ponder.
What's that?
In a world where we're constantly bombarded with images of perfect smiles, how can we embrace and celebrate the unique beauty of our own natural smiles? It's a question worth reflecting on as you navigate the world of cosmetic dentistry and make choices that align with your values and priorities. Thanks for joining us on this deep dive.